Hello, I'm Dr. Maury Markman from City of Hope, and I would like in this session and the next two sessions of Mr. Markman to talk about a general topic that is rarely discussed within the area of precision cancer medicine. And I consider precision cancer medicine to be truly revolutionary. And to be clear, I'm what might be labeled a huge supporter of this process of cancer management, of thinking about how we come up with new strategies across the board. Precision cancer medicine is unquestionably part of the future in a major way and has revolutionized in many ways how we treat patients today. And let me be clear, we are literally at the beginning of this particular process in treatment, and we're beginning to see very important efforts in prevention and screening. In addition, we have shown that there is the potential, very realistic potential, to fundamentally change the management of certain cancers. And here I'm not talking about just one drug versus another drug, but for example, in mismatch repair deficient localized rectal cancer, we are on the verge of beginning to consider standard of care, or at least discuss the option of standard of care being immunotherapy only without surgery. And that is truly a fundamental change in management of this particular group of cancers. And to be clear, we have not even begun to consider the absolute giant in the room, which is the topic of pharmacogenomics. We have a little bit of understanding of that as relates to, for example, 5-FU and 5-FU toxicity. And there's increasing appropriate advocacy of basically saying standard of care or best practice, however you want to say it, should be to obtain a genomic profile as relates to the risk, metabolism of the drug, and potential excessive toxicity. And recent reports have suggested that the use of standard of care for decades, cytarabine, cytosine rabunoside, use of this drug may be optimized. Certainly, it's been shown in pediatric cancers. We'll soon find out pediatric leukemia. We'll find out in adults whether that information about particular germline profiles, we're talking about normal, but variants, might influence metabolism of the drug such that you can favorably affect outcomes by that knowledge for even well-established drugs. We also obviously we're beginning to look at the question of liquid tumor biopsies to monitor the course of treatment and institute specific targeted therapeutic agents based on molecular resistance mechanisms. This is an incredibly exciting development, as it obviously promises not only to improve survival of patients with malignant disease, but also to minimize the toxicity as we don't use or stop using drugs that are ineffective for that individual patient. And I should add, reduce the cost as well. Clearly, this is a major positive development which will only increase in our thought processes, in our research strategies, in our clinical care for patients with malignancy, including within the space of prevention and screening. However, in the midst of these exciting and increasingly rapid advancements in both molecular diagnostics and the therapeutic agents and strategies based on these exquisitely sensitive and more specific all the time testing platforms, there are two very specific concerns that are, I would argue, extremely relevant to this conversation, which need to be increasingly highlighted. And I hope to do that over the next two segments of Minutes with Markman. And I thank you for your attention.